The care of cancer patients these days has become much more multidisciplinary and more complex than it had been in the past. And so it's really important to be able to coordinate between different disciplines so that the patients get the optimal care. And that coordination can happen on a number of levels. It can happen on an individual patient level, so just seeing a single patient and then discussing them with your colleagues. And that's how it happens most often on a day-to-day basis. But I think as we become more familiar with immune therapies, immuno-oncology, we've begun to develop, sort of general principles of how we treat patients. And those get developed through things like tumor boards, cancer committees, so that the interactions become more rote and more set.
The team is critical when you think about cancer immunotherapy for patients, and our team, of course, comprises myself as a medical oncologist, but there's also surgical oncology, pharmacy, supportive care, nursing, advanced practitioners, and it's a large and very integrated team that's important. But it's about trying to get everyone in the same geographic location to whatever extent possible when you are making decisions about immunotherapy and their treatment options. One part that we often forget about this team approach also is the patient itself. The critical thing about immunotherapy and managing the side effects is not just the decision making, but how we can get them through the treatment. If the side effects occur, which do occur, they occur mostly at home. And if they don't contact you, you're never going to know that they happened, and you cannot intervene. So getting that communication piece from the patient has been a big change for me. In the past, it was, you kind of treated a patient, you knew exactly what was going to happen. Now the side effects usually don't occur, but they're unpredictable. So we require that patient's cooperation, and that's been a big change for us in making sure that we educate and re-educate the patient almost at every visit. Don't forget that a side effect hasn't happened for 6 months, it could happen tomorrow. Patients with autoimmune disease are challenging when you think about giving them immunotherapy in general, because obviously autoimmune disease is what we produce as a side effect of immunotherapy. So if you have the autoimmune disease to start with, there's a chance you could make that aggravated. So the best thing we do is we coordinate and our team approach again. If there's a rheumatological problem, for example, we get the rheumatologist on board. Because at the end of the day, cancer is cancer. So you got to be aggressive within reason. But if you get the right team, so if I have a rheumatologist helping me with a patient who has a rheumatological autoimmune disease to start, things can go a lot smoother. I can know when to stop with that other doctor's help and manage the care in a better way. So ACCC has got great resources. We have an Immuno-Oncology Institute as part of ACCC, involved in creating materials, putting together programs to really take the knowledge and information out to the people that are taking care of these patients. And I don't mean just the doctors. I mean the nurses, the pharmacists, the whole healthcare team.
I think that's the one unique and important niche that ACCC has, is that they really are aiming toward educating the entire cancer care team.